Welcome to another Ultrasound of the Week. I'm Dr. Michael Schick. This week we have a 68-year-old male who comes in for acute abdominal pain. He endorses vomiting, he has had constipation, and has had some previous surgeries on his abdomen. On your exam, his abdomen is tympanic, diffusely tender to palpation, and has mild distension. The patient appears stable. You place IV, O2 monitor, and then think about what do you have to do next. You consider your diagnostic studies. Certainly some labs need to be sent. You consider x-ray, then you remember how terrible it is for diagnosing just about anything in the abdomen. And then you think about your CT. You call radiology because you're concerned about an obstruction, and they want you to use oral contrast. There's about 8 or 9 people ahead of your patient. And it turns out he's suffered some acute kidney injury or possibly just has chronic kidney disease. So you bring in the ultrasound, and this is what you see. You ever wondered what back and forth peristalsis is, or antegrade retrograde peristalsis? Here it is. It is literally stool contents moving up through the bowel and then heading right back down because there's just nowhere for that stool to go as the patient is obstructed. It is also colorfully referred to as a poop waterfall. Other sonographic signs of small bowel obstruction are a bowel diameter of greater than 3 centimeters, a bowel wall thickness greater than 3 millimeters. You can have adjacent free fluid in the abdomen, and you can also look for a transition point, although this takes more time. There'll be some point beyond the obstruction that the bowel will be decompressed. All in all, not a difficult exam, as your normally air-filled bowel is now filled with fluid and stool, and you can often see that edematous thick bowel wall very easily. You just have to keep that probe still for a few seconds so you can actually watch the peristalsis. I always look in all 4 quadrants and I use serial compression. Just like an appendix that doesn't compress with ultrasound, the same is true with obstructed small bowel.